All right, fantastic. I'm excited to be here today with the YMCA. Special thanks to Mike for inviting us in for this presentation on balancing act. For those of you who don't know me, my name is Kristen Wilson. I am a physical therapist and co-owner of Action Potential Physical Therapy. We have two locations, one in Glen Mills, Pennsylvania, and a newer location in Kennett Square. And we have been absolutely thrilled to enjoy our partnership with the Kennett and Jennersville YMCA, along with the other local YMCAs, just because we're just so happy to be giving back to our community in the form of education, as well as our physical therapy services. Today's presentation is a fantastic kickoff for the balance class that Mike's group will be starting around, I believe it's April 28th. And not only are we excited to have this presentation today, but for that class, my business partner, Kathy, is actually going to be coming into the group to speak about some opportunities for home setup to reduce your risk for falls in the home. So that'll have some great, tangible, literal take-home tips for you. Today is really meant to set the stage to give a good understanding of how balance affects the body and why this is such an important topic. And so in today's presentation, we'll talk first a little bit about falls in particular and why they're such a hot topic, particularly among the aging population. And we'll look at some of the statistics, which I would imagine, like I was, you'll be shocked to see how many people are having falls per year. We'll then get into the meat and potatoes of the presentation, which is going to be more about the risk factors to help identify what are the things that could actually cause a fall or a loss of balance, and most specifically, the prevention. So certainly we'll close this up with a discussion about both physical therapy and balance training classes and why those are so absolutely critical in helping to maintain balance throughout your life, to maintain independence and a very active lifestyle. So let's start first by just defining what is a fall. And I'm a professor at Newman University and I teach physical therapy students. And when we have our lecture on balance, I always take a moment to show this exact same slide to my doctorate level students. And that's because many people define falls or loss of balance in a very, very different way. So I'm a word geek, so I had to include in here the actual Webster Dictionary definition. And there's two of them. So the first is an unexpected event in which the participant comes to rest on the ground, floor, or lower level. And then the second definition is to leave an erect position suddenly and involuntarily. However, when we look at things like a fall in the context of a health professional, whether it's a personal trainer or a physical therapist, we tend to take a much broader view of this very specific definition. So when I work with clients in the clinic, I'll often ask, have you had any falls? And 9 times out of 10, the answer is no, of course not. I haven't had any falls. But when I broaden that question to say, okay, well, are there times when you feel unsteady? Or have you cut your toe and tripped? Do you feel like you're a little bit off balance when you walk on things like grass or a slippery surface or gravel? Or have you had any moments of dizziness that have challenged your balance? Suddenly, once I start to broaden that view of a fall, people are like, oh yeah, that happens to me all the time. Yes, I'm definitely unsteady on grass or when I have to walk to my grandson's ball game. And it really shows that when we look at balance, we want to take this very broad view because what we don't want to happen is an unexpected event where someone comes to rest on a lower surface. We want to avoid that catastrophic fall and instead capture these instances of instability and remediate those so that we don't have such an issue where there is a fall. The reason this is such a hot topic, both in society and particularly in medical fields like personal training, athletic training, and physical therapy, is because falls are an incredibly prevalent condition in our communities. So we see that as someone gets older, and I use the qualifier as age 55 plus, which is the actual definition of moving into the geriatric population. I know, hold your breath, it sounds scary. Once we cross over that 55 and older category, we see that there's significant increased risk for loss of balance or falls as we get older. In fact, in a calendar year, it is estimated that roughly 33%, one in every three adults over the age of 65, have a fall in a calendar year. When we look at that number in institutionalized or homebound elders, that number jumps to 66%. So 2 out of every 3 individuals are having a fall per year. Now, the interesting thing about this data is that most falls go unreported. And the reason that is because people are afraid to admit that they had a fall. Because once they say, "Ooh, I lost my balance," or "I had a fall," well, next thing you know, they're afraid that, "Oh gosh, does this mean I'm not going to be able to drive? Does this mean I can't live by myself anymore?" So people start to keep that really close to the cuff and don't share that experience with their loved ones, their healthcare practitioners, their personal trainers, whoever it might be. So while this number, 33 to 63%, is already shocking, most medical professionals realize that that's probably grossly underestimated. And in fact, we're probably seeing significantly higher rates of loss of balance and, more specifically, falls in a calendar year. The reason this is so absolutely pertinent in this country and for anyone involved in the medical field is that it's a massive, massive medical expense to manage falls and loss of balance. In this stat is very old. This is from 2000, so we're looking at over 20 years ago. But in the year 2000, we saw 0.2 billion with a B dollars spent on managing falls. And that comes from injury remediation. It can cause from the indirect healthcare related costs of having to provide assistance in the home. Maybe it's the moving expenses. Maybe it's costs incurred by family members. But we see that this is no small lump of money. And again, that's a 20-year-old statistic. So I anticipate that that is significantly higher now. The reason we're so concerned about these darn falls is that the risk for injury is incredibly high. So the most common injuries reported in an emergency room after a fall are hip fracture, which is actually one of the top mortality rates for individuals over the age of 60, head injury, spinal injury or spinal fracture, and then a broken wrist, back, or pelvis. Oftentimes when someone has a fall, they put their hands out to try to stop that fall, end up with a broken wrist, or maybe they land right on their bottom and that ends up causing a fracture of the spine or of the two pelvic bones where they join. So we see that this can be a very, very dangerous condition because it can cause a lot of serious injuries that require time and medical intervention to heal. When we look at the risk factors for falls, it's important that we recognize that there are things that are within our own bodies or intrinsic risk factors that will lead towards an increased risk of fall, as well as some outside risk factors or extrinsic risk factors that can lead to a fall. The interesting thing about this is that in many cases, extrinsic risk factors can be modified. So that essentially means falls are preventable. We have a lot of control of how we can set up the environment and set up our own individual situation so that the risk factors are in turn reduced and falls are significantly reduced. But let's first talk about some of the intrinsic risk factors. And in many cases, there are some of these that can't be modified. And then there's others that can be modified through diet and exercise. So the first is that women have a greater risk of falls compared to men. In many cases, this is because women live longer than men. And as we talked about, as we get older, we see a higher rate of falls. So that could explain some of this. It also explains the difference in workload of our older individuals. In many cases, women tend to be a little bit more sedentary than our men, and that can lead to further reduction of strength and balance capabilities. Certainly, if you're over the age of 80, that's going to increase your risk for falls because as we talked about, as we advance in age, the balance system is starting to weaken, and we want to make sure that we're mindful of that. That's not to say that once we get older, we can't control and reduce falls risk. In fact, it's actually quite the opposite. Research shows that with proper balance training, both through balance classes and physical therapy, we do see equal improvement in balance when compared to a younger counterpart. So this is fantastic news for all of you out there that are taking those steps to help reduce your falls risk. If you have osteoporosis, that increases your risk for falling. It also increases your risk for injury during a fall. You can see here in this photograph, the picture on the left of normal bone. You see that very dense collection of bone material. And compared to the picture on the right with osteoporosis, those big giant air holes essentially make that bone significantly weaker. We don't have nearly as much calcium to help create that infrastructure internally. Those with depression and cognitive impairment or reduced cognition, like memory problems or problem-solving issues, they do have a higher risk for falls. And oftentimes that's because, for one, in depression is often correlated with a lower activity level. And with cognitive impairment, we see that sometimes people aren't able to identify an unsafe environment and therefore proceed and end up having a fall as a result of being in an unsafe condition. Some other intrinsic risk factors, visual deficits. So certainly in our older adults, we see a prevalence of cataracts, macular degeneration, and glaucoma. All three of those can lead towards an inability to perceive the environment, which can alter how your body changes its balance. Vision is one of the three major body systems that contribute towards being able to keep your balance. And when we see a reduction in visual capacity, that can lead to a reduction in overall balance capabilities. In many cases, that is able to be remediated with specific training and visual treatment. A history of falls. The statistics show that if you've had a history of falls in the past, then you are likely to have another fall in the future. This is really important. We'll talk about this in just a bit on the falls cycle. Really important that we mitigate that falls cycle and break that cycle so that we aren't fearful of doing the tasks necessary to reduce a future fall. Neurological deficits. This could be something like a stroke. It could be neuropathy that's typically caused by diabetes, or some other type of neurological problem like a brain tumor or a tumor on your spinal cord. It could also be something like sciatica, where we have some type of a neurological disruption that can occur at the spinal level. The nervous system is really responsible for helping us to stay balanced. And if we have an issue that decreases that neurological involvement, then it can actually cause an increased risk of falls. And then a cardiovascular deficit. So just like we talked about with nerves, certainly our heart and lungs have to give us the endurance to be able to respond repeatedly to a balance challenge. If our body is working really hard trying to keep blood pumping and oxygen moving, then it's not able to devote energy to staying stable and modifying anything necessary in the environment. Last couple intrinsic risk factors, muscle weakness. We'll talk about this in a bit when we talk about a strengthening program, but specifically we want to make sure that our hips, our core, and our ankles are strong enough to help us overcome a balance disruption. We saw in that definition an involuntary disruption of balance. So we want to make sure that those muscles not only can respond strong enough, but also quick enough so that they're able to catch you and right size the ship before we have something like a fall or serious loss of balance. Walking problems is another significant risk factor for falls. And that risk dramatically increases if you're someone who needs to use a walker, a cane, or a rollator, which is the four-wheeled walker. When we see the introduction of one of those devices, it often means that the body is not able to handle that strategy or that technique on its own and must rely on an outside source for stability. Certainly, providing an assistive device like a walker, cane, or rollator can help to mitigate balance problems, but you'll want to do that in conjunction with a skilled physical therapist who can guide you in using it correctly and also challenge your system so that you are able to keep your balance strategies improved. Impaired daily tasks. This could be anything from yard work, kitchen work, doing the laundry. Maybe it's going up and down the stairs or getting on and off the toilet. Driving and walking across the parking lot to the grocery store, if you're noticing that during any of those tasks, you're either losing your balance or feeling very fearful, that's a sign that you're at risk for a future fall. And then lastly, arthritis. Certainly, most people think of arthritis as being a painful thing and more a pain in the butt than anything. But arthritis can contribute to an increased risk for falls because it alters how our joints can respond. So, certainly, if you have arthritis that's making you feel unstable, someone like a physical therapist can help teach you how to use your body correctly so that it helps to mitigate some of that pain. In contrast, extrinsic factors like we talked about can often be modified and a very easy fix for helping to reduce pain. The first of those is medications. There's plenty of research out there that indicates if you are taking more than 4 medications or supplements, you are at a higher risk for falls compared to a counterpart. Certainly, medications are more influential than something like an over the counter supplement, but even still, a conversation worth having with your family doc or internal medicine doctor. The 4 biggest culprits for medication are antiarrhythmics. This would be a medication that you take for something like AFib or an irregular heartbeat. Psychotropics, these are antidepressants or things to manage anxiety. Diuretics is a water pill to help manage fluid within your body. This is problematic because it can actually drop your blood pressure. And then lastly, antihypertensives or medications that will alter if you have high blood pressure. So in my 17 years as a physical therapist, I've seen often many combinations of these 4 medications on board. And oftentimes that requires a conversation back to the family doc to say, hey, is there a way that we could maybe streamline some of these medications? And then if the answer to that is no, they're all necessary, then it's a matter of teaching good strategies for making sure that a balance concern doesn't present itself. Environmental factors, this could be everything from surface that you're walking on. So for example, where I am here at my office, we have carpet, we have tile, we have pavement outside, and then there's also a little grassy knoll. We have curb steps and ramps. All of those different surfaces pose a challenge to the body so that we can see how to accommodate and move accordingly. Footwear is often one that people overlook. Many of my older patients will wear very sound footwear when they come into therapy, like a solid sneaker or maybe an Oxford that's laced. However, what I tend to bring the conversation up to is, okay, well, what kind of slippers are you wearing? And in a lot of cases, people are wearing just little slip-on mules, or maybe they're just wearing bare feet around the house. So it's often necessary to have that conversation about appropriate footwear and how that adjusts your balance. Obstacles within the environment. This could be anything like we previously talked about, like a curb or a ramp, but even more so, things that you don't think about, like a pet, a dog or a cat running through your feet. Maybe it's a grandkid that runs up to give you a big hug. They become a physical obstacle once they're within the periphery of your body. Certainly, it can also be things in your home like furniture or loose pair of shoes strewn on the carpet. So we have to just be mindful of all of the things in the environment, both moving and stable, that could pose an obstacle that we need to navigate around. And then lastly, household environment. And like I said earlier, Kathy will be coming out to the group early in May to talk about what are the best tips to set up your home to help mitigate falls. She'll also touch upon some footwear recommendations, as well as other considerations to help improve your safety and absolutely reduce that risk of falls to near zero. So when we talk about falls, part of what makes this so challenging is that falls create what's known as the fear of fall cycle. And this is something I spend a lot of time lecturing community members as well as students about, because it's really, really important that we immediately break the cycle of falls. So bear with me as I explain through it. Essentially, what happens is someone has a fall, and as a result of that fall, whether it caused injury or didn't, they become very fearful of falling. So now, as a result of that fear, they have less confidence in their ability to do their normal tasks. So they start to cut back on those activities. So maybe it was stubbing their toe walking up and down the stairs, and they thought, oh my gosh, I need to be really careful. I need to hold on tight when I'm on the stairs. So they modify that activity and they restrict it. Well, now, as a result of that, they start to feel less independent and less physically capable. And so they start to restrict their activities and they say, oh gosh, well, if I'm going to go to the Y and there's stairs there, I better rethink that. I better not go up to that presentation that's on the second floor. And they start to have this social isolation or dependency on others. Maybe it's, taking the elevator or having someone escort them up the stairs. Or maybe it's making sure they're only doing the steps in their home when their spouse or a partner is home. And as a result of that, we start to see the body experiences less mobility. So we see weakness, we see loss of balance, loss of endurance. And then as a result, that puts us at a higher risk for a fall. So it's this really, really ugly cycle that tends to be a spiral in nature that eventually leads to a very detrimental fall, causing injury. So where someone like myself, a physical therapist, or someone like Mike and his balance program steps in, they're here and we're here to help break that fall cycle, to help build the confidence and build the skills necessary so that we don't have that downward spiral leading towards a fall that could cause serious injury. So the question becomes, how do we do that? So first thing is we set up our home properly. And again, Kathy will be sharing some great tips with the group on how to do that so that you can take a survey around your own home and see, are there things that I can do to help prevent a fall from happening? Second thing you can do is you can have that conversation with your physician about your medication management. If you are taking more than 4 medications, reviewing those with them to say, are these absolutely necessary? And is there a way that I could either taper or modify these, maybe with a natural supplement, to get a similar result? And that will inherently bring down your falls risk. But the two most tangible things that you can do are participate in things like strength training or a balance class, or attend physical therapy to help build back up your physical reserve and your balance capabilities. So let's spend a little bit of time talking about each of those. So the first is balance training and strength training. And those can occur in a setting like the YMCA, can also occur in a really simple setting like your home. And what I'm going to do today is give you access to my free download on the top exercises for healthy aging. And these include some stretches, some strengthening tasks, as well as some balance tasks that can help emphasize the correct musculature to keep you safe and better balanced. Like we talked about before, the emphasis for strengthening is going to be on the hip muscles, the ankle muscles, and the core muscles. And when I say core, that means the muscles around your abdomen and low back, because those muscles are the muscles necessary to help regain a loss of balance if you happen to be pushed off or taken out of your balance support. Some great examples of some hip strengthening exercises, which I know many of the personal trainers at the Y are very proficient in, are things like squats. It could be something like sidestepping, step ups, even something as simple as doing the stairs in your home is a great way to strengthen your hips. And then certainly you can incorporate a cardiovascular or endurance component by using something like an elliptical, a rowing machine, a treadmill, a stepper, or a bicycle to help build that strength around your hips. Ankle musculature, really simple, easy way to do that is rising up on your toes and rising up on your heels and alternating between the two, as well as safely standing on one leg to help build that strength around your ankle. And that standing on one leg, you'll see in the free download that I've included at the end of this presentation. Balance training. The best way to ensure great balance training is to do that in a safe environment. So whether that is a group class like the one you have access to with the YMCA, or something like physical therapy where you have a skilled professional there who's able to monitor your performance and guide you through some very difficult but appropriate tasks, we can ensure that we keep you safe so that you're able to get the right amount of challenge without it being too difficult of a challenge that leads to a fall. You can imagine one of the things that I'm often apprehensive about is having people do balance exercises, true balance exercises at home without any guidance or safety measures. Because certainly, in order for that balance exercise to be effective, it has to be so challenging that it causes you to lose your balance. But the hesitation is, if you're going to lose your balance, I certainly don't want you to have a fall while you're at your home. So some things to think about if you are going to do some easier tasks like standing heel toe or standing on one leg at home, you're going to want to make sure you're in an environment where you can hold on. And my favorite place to do that is right on the kitchen counter where the sink is, because you can either hold it or you can put your arm inside where the sink is. So if you lose your balance, you've got a really firm surface to hold on to that you're not going to slip off of. Other things to keep in mind if you're going to work on your balance is have your phone within reach. And within reach might not mean up on the kitchen counter in case you fall to the ground. It might mean in a pocket, or maybe it's on the surface of a chair right in front of you, so that if you were to fall to the ground, you could still reach up and grab that phone. And then lastly, when working your balance, it's important to have proper footwear or to practice in your bare feet. I hesitate to have people practice in their stocking feet because it can often be very slippery. But in therapy, sometimes we'll do balance training barefoot because it helps to really work those muscles of the ankle. Or if you're doing it in more of like a group class setting, making sure that you have a good solid sneaker that has a heel cup so that your foot is very supported within the shoe. Aside from physical therapy, I can't advocate enough for a group class on balance. There's plenty of literature out there that shows that participating in a balance class like the one offered at the YMCA will significantly reduce your risk for falls and keep your independence higher throughout many years. And I often will encourage people, don't just take it once, take it maybe every couple of years so that you're able to go in and spruce up your balance and keep those skills necessary. One of the biggest misnomers about balance is that once you start to lose your balance or start to lose your balance skills, that they're gone forever. And that's part of normal aging. And that is absolutely not true. Even into your 90s and hundreds, we can still fine tune the balance system and improve your strength and your speed of recovery so that if you do lose your balance, you have the skills necessary to step out and regain your balance. So no matter the age, no matter the health condition, physical therapy and balance classes can help restore your ability to stay very balanced and safe in your home and community environment. Certainly, there are certain ways that physical therapy can be very helpful that go a little bit beyond just a traditional balance class. This would be things like advising on specific home recommendations. So oftentimes I'll have people either take pictures of their home, or maybe we do a telehealth session where I look at their home on their device and I can make specific recommendations to them. I can also advise and train on proper equipment. So let's say someone has very poor balance because of certain medical conditions, and maybe they need a cane or they need a walker to help them be more independent. My job is to look at their performance and choose and recommend the best piece of equipment and then work in conjunction with them to make sure it's the right fit for them. I've never been a therapist to say, you need to use this, this is what you have to do. It's a conversation. We work together to figure out what's the type of device that fits best into your lifestyle. And then I work with you to make sure that you can safely utilize that to reduce your risk for falls. Strengthening and balance training. Certainly when you come in for physical therapy to work on your balance, we're going to challenge you to the most of your capability. We make it fun. It's very safe. There's no risk for falls. And what we do is we try to come up with as many simulated tasks that maybe you need to do in your own home environment. For example, I had a patient come in one time and say, listen, I live by myself and I have to be able to change a light bulb in the top of my closet. So that might involve us working on stepping up onto a step ladder and reaching up overhead to change that light bulb. we can customize that and make it safe and challenging, but also fun and appropriate so that someone can be independent in the tasks that they need to do. One area that many people don't realize help with balance is by using orthotics in your shoes. Those are the little inserts that you put in the bottom of your shoes. As we get older, sometimes our feet can start to take on some abnormal foot postures or foot alignment, and that can cause some abnormal reflexes to occur within the toes, like the toes grabbing down to the ground or the toes flaring up in the air. Our job is to help mitigate those abnormal postures, and we can build a custom orthotic that's covered by your insurance to slip right into your shoe and help your foot settle down. So that is something that certainly it's a little bit more of a skillful and specific task, but one that we will look at to make sure that your foot is able to do what it needs to keep yourself balanced. And then lastly, where I think physical therapists demonstrate the most prowess is in helping to build the confidence of our patients that do feel fearful or have had an increase in loss of balance or instability. And what we do is we give you the skills and the confidence to break that fear pattern and that cycle so that you're not starting to restrict activities, but instead you're embracing it, working on it, and moving forward in a much more confident and independent manner. And I think there's no better profession on the planet to do that than a physical therapist. So really, in conclusion, you should never be afraid of falling. That is something that is absolutely preventable and remediable. So when we talk about falls, know that falls are preventable, whether it's through modifying the external environment or improving your physical capability through strength and balance training. There are certainly many resources available in the community to help mitigate this falling or lack of balance. And you have access to one of the best ones available, which is the balance class through the Y. Certainly, if there's something more specific or skillful that's necessary, we're right here in your backyard and happy to help in any way possible. But certainly know that whether it's Mike at the Y or me at Action Potential, we are always here to help to keep our community safe. Certainly, I appreciate the opportunity to share this with you. And as a thank you, want to extend this free download, which has my top 5 exercises for healthy aging. You are welcome to download that at reachyours.com/healthy aging. That will allow you to kind of see my barrage of flexibility, strengthening, and balance tasks that I specifically recommend for my over 55 population. And if there are any questions at all, you're more than welcome to reach out to me at my email, kwilson@reachyours.com. And certainly Mike has access to all of our information, as well as we have little handouts right in the lobby of the Y in the event that you need to get in contact with us at either one of our locations, both in Kennett Square and in Glen Mills. So certainly I am thrilled to hear that all of you have taken an interest in your safety and balance, and am very excited to hear how the balance class goes with Mike. And just as a reminder, keep an eye out for Kathy, who will be coming out sometime early May to help share with you some very, very actionable tips for modifying the home. Thank you so much for the opportunity to talk with the group today. And I absolutely look forward to future topics alongside the YMCA in our partnership for keeping the community safe. Thanks so much. And